So, okay, our project is on laser removal, or vegetation rather. I'm called Solleveld.
My name's Raymond. I'm Velsko.
I'm Kaylene. I'm Medina. And I'm Anna.
So basically, how do lasers work? Basically, there's a laser material, which is excited by a flash lamp. It's a very specific band. It's basically fluorescent. It's sandwiched between two reflectors. One is partial, rather. That's so the laser can escape, otherwise you end up with just something that does nothing. So that's basically how it works. You can replace your partial reflector, which would be continuous to use with a Q switch. Q switch basically just allows you to send a pulse. I'll go over that in a little bit. Here's a diagram of laser, sort of excitation. We have this blue arrow, which represents exciting it using a flashlight. The red arrows represent very quick pace. Now, the key here is that most of your population will end up here after you start pumping it. It's called population movement. It's necessary for laser to occur. So byproduct of these being very quickly decaying, you end up with a lot of population here, not of population here. So, it's blazing. Right, okay. Oh, other thing, these things don't emit photons sometimes, so you end up heating up the laser, which is very bad because it burns. Okay, so how do lasers remove tattoos? It's basically like how aliens kill humans. It's actually they explode. So, okay, so the reason why you have to use lasers of a certain wavelength is because tattoos are pigments, they only absorb certain wavelengths. Ideally, your flesh won't absorb this wavelength either because it's very bad. So one of the major problems is different things have different properties. You can't use the same laser for all color things because they have different colors. One of them might reflect it, one of them might absorb it. So basically it's a thermal gradient. So the laser heats up the ink particle, your body's not so hot, causes cracking, it fragments, your body's immune system removes it. So other tattoos, amateur tattoos have larger particles, so it requires more treatments. Particles themselves are very different between inks, which cause problems. So here's Q switching. Basically, Q switching is a mirror, and then you can make it not a mirror. Basically, you switch from a high Q value, meaning high reflectance, to low Q value, low reflectance. It's within the resonance chamber, so it's a little chunk of other crystal in the resonance chamber that prevents this from happening. Passive Q switching is normally used. Okay, that's when you use a small piece of crystal. There's various ways of Q switching, but okay. Passive Q switching is basically you build up power over a period of time. Once it reaches a certain intensity, there is a chemical reaction, it breaks down, and you can allow laser light through, and then once the intensity drops off, it comes back. And you end up with just a pulse of very high power for a very short period of time. And this is important because doctors are lazy and they can do that by hand.
Alright, so I'm presenting on Nd:YAG laser, which is neodymium doped yttrium aluminum garnet, and this crystal is a colorless, optically isotropic crystal that possesses a cubic structure characteristic of garnet. And with this cubic structure, it has a very narrow fluorescence line width, which allows high gain and low threshold for laser operation. And the crystal can withstand very high temperatures. So the melting point is at 1,970 degrees Celsius, and it's very durable. The laser, here are the laser properties. The fluorescence lifetime is at 230 microseconds, so it's very fast. The photon energy is at 1.86 times 10 to the negative 19 joules. It's low photon energy. It emits a wavelength of 1,064 nanometers, and the absorption of the crystal is at 730 to 760 and 790 to 820. So the type of ink that would be very useful, or that it could remove at this wavelength, would be black and blue colors. But if you double the frequency, you can also, it would lower the wavelength down to 532 nanometers, which would be able to remove red ink. The spot size of the laser is 3 millimeters. The pulse duration, so each pulse would be around 10 to 20 nanoseconds. It's very fast. And then the fluence range is between 5 to 10 joules per centimeter square. Here's an example of the YAG laser. So as what Paul was saying, the flash pump or the pumping lamp is on top. Two reflectors, or the mirrors, are on the sides, and the rod of the crystal is in the middle. And here's the actual machine right here on the side. And the optical fiber right here, that's where the actual laser is being emitted. It's having contact with the skin. Here is a 60-year-old male patient that had a tattoo of black ink. And after 8 treatments, you can see right here that there's barely any scars or any other things. So pretty much the whole tattoo was removed.
Okay, so this is the ruby laser. It was the first laser material discovered, and what a ruby is sapphire or aluminum oxide with chromium impurities in it, and the chromium is what gives it its red color. The laser emits a wavelength of 694 nanometers. It has a pulse duration of 25 to 40 nanoseconds, and for clinical use, it has a spot size of 5 millimeters, which is larger than in most lasers for tattoo removal, and it has a fluency of 4 to 10 joules per meter square. Okay, so here's a picture of the first ruby laser device, and what you should notice is a spiral flash lamp, which shines a bright white light onto the ruby laser and excites the atoms in the ruby. And you have a mirrored surface on one end and a partially mirrored surface on the other. And with the first one, the partially mirrored surface allowed continuous lasing to occur at a lower intensity. So you would want to change it with a Q switch, like Paul was talking about, so intensity can build up and be released. And once released, it can remove blue, black, and green ink from tattoos. Okay, so here's the basic concept of the ruby emission. So you pump in a green band and a blue band, and 2 paths can occur. So once the atoms are excited to this high energy level denoted N4, it decays into N3 and it quickly decays into N2, where a population builds up in N2. Or it can go from N4 directly into N2 to also build up a population N2, thus creating a higher population N2 versus N1, which is called population inversion, and lasing can occur. Here's a picture of treatment with a ruby laser. So after only 6 treatments on this professional black tattoo, the tattoo is pretty much all gone.
And this is the Alexandrite laser compared to the Nd:YAG laser. As you can see, it has an extra mirror system in here to ensure ion exchanging the ion energy. And there's an Alexandrite crystal rod in here, which I'll go over the crystal properties in a little bit. And these different reflective mirrors actually lead to a homogeneous beam to form onto the skin so that the laser can excite enough reflections and have a high enough energy to target the pigmentation of the ink. And also to aim for the laser, they use a helium neon laser coaxial, which I'll show in an image later, to actually aim on where you want it to place on the skin too. And so the important properties of the crystal allow for the intensity of that we can emit a certain wavelength. So this is actually the chemical formula of crystal beryl, which is just, and the difference with crystal beryl and alexandrite is the different chromium ions. So since there are different chromium ions, there's a different excitation levels and different interactions that can happen. So strong ion-ion interactions are coupled chromium ions that interact with each other, while weak ion interactions are only single chromium ions that interact with each other. And we want a high-quality crystal to achieve this, so we need strong interactions. And different colors are emitted due to the different chromium interactions. So we have a purple one from the strong ones, which we use in the actual laser. And this is what the actual laser looks like. It's Alexandrite Q switch, which is best for tattoo removal. So it emits it's close to the ruby laser, which is 755 nanometers, and then a spot size of 3 millimeters. And the pulse duration is 90 to 110 nanoseconds, which is one of the longest due to the longer wavelength. And the fluency is 4 to 8 joules per centimeter squared, which is the amount of energy through the surface of the skin to target the pigmentation and, like Paul said earlier, break apart the ink through macrophage engulfment. And so this is the laser itself and the coaxial that is aiming towards what spot on the tattoo. The best pigmentation is pale or medium skin, since that's what emits through the skin the best. And it's best to remove blue, black, or greening, and requires an average of 8.9 treatments to remove about 95% of the tattoo, since only after one treatment, most of the lasers only have way less than 25% removal. And so this is a comparison between a treatment between professional and amateur tattoos. So these are full treatments. And as you can see, the amateur tattoo really, since the ink is very dispersed, it's not as great of a well-done tattoo. It's harder to remove. So.
Okay. My name is Anna, and I'm going to talk to you about some of the factors that are going to contribute to your treatment of laser removal, like tattoo laser removal. Sorry. So here you can see a table of the colors that are most affected by each laser. So the alexandrite and the ruby laser affect the dark colors like black, blue, and green, and the YAG laser targets black and blue, but also red. So this is going to help you determine what laser to use to remove your tattoo based on which colors. Now you might notice that there aren't any other colors on there like yellow or orange, and that's because pigments that are mixed and also light are really hard to get rid of, because sometimes you don't know the wavelength that they're at, so you can't target them. But fortunately, there's a chemical change that happens an oxidation reaction that happens to the pigment colors, and it changes most of the colors to black. So, for example, a red pigment, which is a ferrous pigment, which will oxidize to ferrous oxide, which is black, and that helps the other lasers target that. So you can also see here the white pigment in the teeth of the skeleton becomes sort of like a grayish black, and that also helps you eliminate it later on in treatments. You can see in a histology that the pigments are not necessarily in the cells, but around them, and so you're not targeting cells and killing cells, and you're targeting the pigments instead. And in an after treatment histology, there's not much scar tissue, so that's good. But sometimes there is scarring in the chest and upper arm and ankle, but these are areas where the skin is very thin. And there are also textural changes, pruritus and cobblestone texture, but these can be prevented with topical corticosteroids after treatment, and also spacing your treatment out, leaving time for the skin to heal. Hyperpigmentation is darkening of the skin, and hypopigmentation happens as lightening of the skin. And they look for the color of your skin to also determine what laser to use as well.
Okay, so I'm going to go over a comparison of the lasers, and here's a beam profile comparison. So the alexandrite, which is over here, has the most even energy distribution because of its fiber optic release mechanism. So it has it's described as a top hat. The YAG right next to it is described to have a witch hat beam profile, and this one has the most uneven energy distribution. I believe both of these have the same spot size. The only different one is the ruby, which has the largest spot size and is described as having best of both worlds. So, so comparing the treatment, the YAG and the ruby are very similar in energy distributions at the site of the irradiation, although the ruby is the one that has the highest chance of hyperpigmentation or hypopigmentation, and it's attributed to its wavelength. In a comparison of treatments versus factors of lightening, the ruby continued to perform the best. So here's a three-way comparison of the ruby, the alexandrite, and the YAG. So over here on this one, the last final one, as you can see, the ruby had the most whitening out of the two. But this can sometimes not be preferable if you're of a darker skin tone. So you get permanently bleached. So overall, depending on the pigment and your skin color, one laser may be better over another laser. We concluded that ruby lasers have the best chance at removing a tattoo. and the positive results outweigh the side effects. Here are references.
We have about 30 seconds for questions.
There's only two, so go. You first.
I was just going to ask, how painful are all of these procedures?
It feels like a rubber band slap. Next.
So I noticed all the pictures of people with similar skin tone. So if you were of a darker skin tone, would your cells actually be popped by that wavelength?
Yeah. It actually vaporizes, heats up water molecules, and it expands your cells, and they die. They explode, literally.
But that's not so bad because it recruits immune cells to the site, so they can take part of the small fragments that you break off. So,
Okay.